Hello, I'm Dr. Needu. Today I'm going to discuss about ECG waves and intervals. The first wave is P wave. P wave denotes atrial depolarization. Duration is less than 0.12 second and the height is less than 2.5 millimeter. So the first half of P wave is in right atrium and the second half of P wave is in left atrium. So any enlargement causes the size or changes in the size or duration of P wave depends on which atria is affected. In case of right atrial enlargement, we will get a tall P wave or P pulmonale. So this is because right atrial enlargement is causes increased muscle mass in the right atrium. So more muscle means greater electrical amplitude. So the more stronger impulses are generated. So the height increases and duration remains same. So we will get a tall P wave in right atrial enlargement. But in case of left atrial enlargement, we will get P mitrale. That is because left atrial enlargement causes the increase in size of the left atrium. So it will take longer time to travel the entire left atrium, the enlarged left atrium. So more distance means prolonged conduction time. So we will get a broad P wave and the height remains same, the duration is longer, so longer prolonged conduction time. So in right atrial enlargement we will get a tall P wave and in left atrial enlargement we will get a broad P wave, and P wave is absent in case of atrial fibrillation. That is because there is no organized atrial depolarization takes place, so we will not get a P wave. We'll get an absent P wave in case of atrial fibrillation. Instead, we will get fibrillatory waves. So that's all about P wave. Next is PR interval. PR interval is start of P wave and start of QRS. So in between what all events takes place? Atrial depolarization, AV nodal delay, then bundle of His, then the impulse reaches Purkinje fibers. Then only ventricular depolarization takes place. So from start of P to start of QRS. And the duration is between 0.1 to 0.20 seconds. So in case of AV block, we will get a prolonged PR interval. That is because what happens in AV block, that first degree AV block, AV node is already a delay station. When impulses reaches the AV node, what happens? The impulses slower down. But in case of AV block, again the impulse gets slower than the usual, and the impulse reaches ventricles very slowly. So ventricles get activated very slowly. So we will get a prolonged PR interval. But in case of Wolff-Parkinson-White syndrome, we will get a short PR interval. That is because in WPW syndrome, there is an accessory pathway called bundle of Kent, and the impulse bypasses AV node. So impulse reaches directly from atria to the ventricles. So there is no delay in the AV node. So we will get a short PR interval. So that's all about the PR interval. This complex denotes ventricular depolarization. Normal duration is less than 0.12 seconds. So we'll get a wide QRS complex in bundle branch block. So one bundle branch block means there will be a block in either of the bundle branch, that is either left bundle branch or right bundle branch. So what happens? The depolarization happens very slowly. It happens very slowly, so that we will get a wide QRS complex. Also, it is wider in case of hyperkalemia. So in hyperkalemia, there will be more K plus ions in the ECF, extracellular fluid. So this more K plus ions will affect it will affect the resting membrane potential, and it inactivates the sodium channels. So if the sodium channel is inactivated, depolarization happens very slowly. So we will get a wide QRS complex. So that's all about the QRS complex. Next is ST segment. It is between QRS and T wave. It is a time when the ventricles are fully depolarized. So the baseline will be, it is isoelectric, the baseline will be flat. That is fully polarized means what? Inside of the cell becomes, it attains a resting membrane potential, that is inside will be negative and outside will be positive. So there will be no voltage difference. So the baseline will be flat. So in case of STEMI, we will get an ST elevation. That is because in STEMI, it causes transmural injury. Transmural injury means all the layers of the heart are affected. All the three layers of heart are affected. That full thickness is affected. So we will get an ST elevation. That is, it will take the time to get depolarized. That is, slow depolarization takes place, and we will get an ST elevation. But in case of NSTEMI, subendocardial injury occurs. That is, only partial occlusion is happening. Okay, not full thickness. So we will get a ST depression. So in STEMI, we will get ST elevation, and in NSTEMI, we will get ST depression. So that's all about ST segment. T wave. T wave denotes ventricular repolarization. So after contraction, what happens? Ventricles go back to the normal state, that is repolarization. So T wave refers to ventricular repolarization. So in certain conditions, the T wave becomes tall and narrow. So it is seen in hyperkalemia. What happens in hyperkalemia? Due to increased potassium ions, it will affect the resting membrane potential. It reduces the resting membrane potential, and it causes early repolarization. So repolarization occurs very fast. So what happens? We will get a narrow, tall T waves. And in case of ischemia, left ventricular hypertrophy, or bundle branch block, there will be abnormal repolarization happens. So we will get a inverted T wave. So that's all about the T wave. Finally, QT interval. QT interval refers to the start. It is from the start of QRS to the end of T wave. So it denotes the entire ventricular activity. So if in case the QT interval is prolonged, that means there will be slow in the ventricular repolarization. Isn't it? Delayed ventricular repolarization occurs. So if the ventricular repolarization is delayed, what happens? It causes the electrical instability, and it is mainly seen in electrolyte imbalances. Certain drugs will cause this, so etc. That's all about the QT interval. So that's all about the ECG waves and interval. Hope you guys understood. So if you like my video and if you understand my video, please do like and subscribe. And thank you for watching.